Hello everyone, it's Dr. Ruddy. Welcome back to Morning Rounds. Today I would like to address the subject of the cost of breast cancer treatment. Specifically, I want to give you some help in controlling the costs of breast cancer treatment. So let me first pose 5 questions to you. The first is, do you want to make sure that you are getting the best treatment for your breast cancer? Question number 2, are you concerned that your breast cancer treatment is costing you too much money? Question number 3, do you feel like a little ball in somebody else's ping pong game? Question number 4, are you looking for some simple guidelines to help guide you through your breast cancer treatment? And number 5, are you the kind of woman who appreciates quality over quantity? If so, let me provide 3 simple suggestions for how you can save money and perhaps your sanity as you go through breast cancer treatment. The first is to get a second opinion, and if you have any questions after the second opinion, to get a third opinion. It's so important when you've been told that you need a biopsy or that your biopsy shows that you have cancer, that you get all of the information you can from the physician or surgeon who has made the diagnosis, and then gather that information and get a second opinion. And then, if you're still concerned and you have questions, get a third opinion. It may cost you a copay, $20, $50. It's not nothing, but it is so worth the investment to either hear the same information provided again, hear the arguments in favor of the treatment that has been provided for you, give yourself time to think about some questions that might have popped up, and really ask yourself and these consultants, what is the best thing for you to do? What are your options? It's not like you have appendicitis. You don't have to go to the operating room that night. You are not in labor. You're not going to be delivering the baby in 12 hours. You really do have several weeks to be able to get the second opinion, get the third opinion, and really appreciate what kind of cancer you have and what is the best treatment that would suit your needs and your situation. The second guideline is to make sure that every test that you ever have, either during breast cancer treatment or following breast cancer treatment, is needed. You must ask the question, why are you ordering this test? What is the information going to give you? Is this information going to change my treatment? If the information that you're going to be getting is not going to change your treatment, if it's not going to help guide where you go from there, there is very little point, unless you're involved in a clinical study, of course, in which case you're not paying for the tests. There's very little point in undergoing testing and paying for tests that are not going to add significant information to your care that will have an impact on your treatment. You can say, well, it's going to help in the prognosis. Prognosis applies to groups of patients. Prognosis does not apply to you. Prognosis is what is the likelihood that a woman with a stage 1 breast cancer will be alive after 5 years. Prognosis is based on what happens to 1,000 women with stage 1 breast cancer fully treated at 5 years. And the good news is over 90% of those women are alive. That doesn't say whether you're going to be alive. So if someone says to you, well, it's going to give you a better prognosis, until they can tell you this is what is going to happen to you, you may not be interested in having a test that's going to tell you what is the probability of your being alive compared to 999 other women. You want to know what's going to happen to you. Always ask the question, Why is this test being ordered? What are you going to do with the information? And is that information going to change my treatment? The third important thing to keep in mind is that there are many ways that you can prevent breast cancer and prevent breast cancer recurrence. So if you've been diagnosed with breast cancer, you're going to have your surgery, you'll have perhaps radiation therapy, you may have chemotherapy, you may have some targeted therapy, someone may give you pills to take for 5 years. But really, after the end of your surgery and your radiation and your chemotherapy, whatever, you're going to be on your own. You're not going to see your surgeon again. You're not going to see your radiation oncologist again. Your medical oncologist may want to see you again in 6 months or a year. Now you're on your own. You drive away, 6 weeks later or 2 months later, and that's it. You're on your own. Except you have me. You have this information. You have the breasthealthandhealing.org website where there's a lot of information. And there's a lot of information that you can glean and apply that will help you prevent breast cancer in the first place and prevent breast cancer recurrence once you've been treated for it. So exercise, modifications of diet. I go into all of these details rather extensively on many of my blogs and many of the YouTube videos I have posted. So the first rule is get a second opinion, get a third opinion. The second rule is ask, is this test needed? What information are you going to get from the test? And is this going to change my treatment? And number 3, really inform yourself about what you can do when you drive away and no one wants to see you again for a year or ever. What can you do to change your diet and your lifestyle and reduce your risk of breast cancer recurrence, in some cases up to 50%, which is better than anything the medical profession now has on offer. I hope that helps. Thumbs up to you, thumbs down to breast cancer. And one last little bit of tangential information. If you are as interested in I am in preserving your wealth in addition to your health, I would like to refer you to a very wonderful woman who is featured in a very interesting YouTube series of videos. She's going to laugh when she sees this because she's always putting up these kinds of pictures. ITM Trading, Lynette Zhang, itmtrading.com. The woman to contact is Donna, 480-526-7870. I hope that doesn't come back to you as some kind of reversed stereoisomer. If it does, I'll correct it. Lynette Zhang knows the inside scoop on the demise of the financial system, impending demise, and the loss of the value of a dollar. So right now we have a United States dollar, which is worth exactly 4 cents. 4 cents. 4 cents. Compared to its value in 1970. In 1970, the dollar was worth $1. Today, it is worth 4 cents. Why? You know this, as I know it, because yesterday I went to Whole Foods and I bought my favorite eggs, which are $5 for a half dozen. That's not because the eggs are worth so much. It's because this dollar is now worth 4 cents. If you want to know how the United States dollar was worth 100 cents in 1970 and is worth 4 cents today, and why eggs are $5 for 6 of them. Yes, they're jumbo. Yes, they're organic. Yes, those are the only eggs that I will eat. $5 for 6 of them? You really do have to be a surgeon to be able to afford to buy eggs. Go to ITM Trading. Watch the YouTube channel, Lynette Zhang. I think I'm going to have to change this, because if I don't see it, then you're not going to see it properly. You can get in touch with Donna, 480-526-7870. I know her personally. She advises me on how to preserve wealth. So preserve your health, preserve your wealth, be well. And again, thumbs up to you, thumbs down to breast cancer.